Hello, I'm Professor Edward Yakupov, and today we're going to talk about the 5 main causes of chest pain. First and foremost, the most dangerous to life and health is cardiogenic chest pain. In other words, pain caused by heart and vascular system pathologies such as myocardial infarction, ischemic heart disease, angina, strains or rest can trigger a variety of very unpleasant sensations due to their intensity and phenomenons on the left half of the chest. Actually, when a person complains of chest pain and even shows with their hand and explains that it burns, stings after physical exertion, climbing stairs after emotional stress, that is one of the typical examples of that very cardiac pathology following, for instance, IBS, tension angina. But when chest pain suddenly appears, in the heart area with radiation, it radiates to the arm, under the shoulder blade, to the shoulder, This is dangerous pain that might point to an ongoing or imminent myocardial infarction. There's no time to wait. You need to urgently seek medical help to receive immediate specialized care in a cardiology hospital or department. The second most common cause of discomfort in the left side of the chest, often misunderstood as heart pain, is vertebrogenic, which means it's related to a pathology of the neck or chest part of the spine. Simply put, some of you might call this osteochondrosis, even though that term has been out of use for a while. But when there's a herniated disc in the neck, it can cause very intense pain in the nape, in and even under the shoulder blade. You might ask me, how to differentiate it from a cardiac pathology? Indeed, this is a job for specialists. One of the differential diagnosis methods is electrocardiography, which allows us to address the question, is the heart affected or not? In the second stage, we take a picture of the neck, investigate the cervical and thoracic sections of the spine, and see if there are problems that could have triggered those quite unpleasant shooting feelings. Sensations up to the fingertips in the hand, under the shoulder blade, or neck. The third cause, very substantial and widespread in its essence, is non-vertebral and non-cardiogenic pain in the left half of the chest linked to anxiety disorders, with panic attacks, meaning patients with emotionally affective disorders and autonomic disorders. This is how I described it. Sensations, discomfort, pain in the left side of the chest because we have nothing to do with the heart. We have nothing to do with heart pathology here. And I want to emphasize this. And the character of the sensations, the nature of the pain is entirely different. Remember, in angina pectoris, a person points to the chest in this way, describing a burning or baking sensation behind the sternum, while in the case of pain, against the background of a panic attack. Against the so-called vegetative background, a person points to their pain just like this, with a finger, or describes it in the most bizarre way. My heart is turning over. I feel a heartbeat. It might jump out of my chest. It's about to burst. All these are descriptions, epithets that we frequently hear from our worried patients. They can, by the way, be accompanied by shortness of breath, a feeling of unease, unpleasant sensations throughout the whole body. But these are not heart pains. The fourth reason, pains in the left part of the chest, are not really associated with any heart pathology per se. It's a neuropathy of the intercostal nerves as a consequence of their injury, say herpes. And that happens quite frequently in elderly people when they suddenly start experiencing burning, sharp pain in the area of the heart, the left nipple. But after a few days, rashes start to appear. The diagnosis here is obvious. It's clear that it's a herpetic lesion of the nervous system. It's accompanied by very unpleasant, sometimes agonizing pains, again in the left side of the chest. And one more, relatively rare, perhaps because it occurs in young people, in teenagers, on a YouTube channel. Patients often come to me and say, this is the age of patients who say, suddenly I was so sick, I had such a strong pain in my heart, maybe I'll die tomorrow, but it's only 15 people, 14, 16 years old. So these unpleasant sensations in the heart are connected with the fact that a person, it's just growing fast enough, and its regulatory systems can't keep up with that growth. Then there is a regulation of our organs. System, in particular the cardiovascular system, which is subject to the work of the brain and the work of the autonomic nervous system. It is disturbed, but it is not disturbed from the point of view of the fact that some serious unknown pathology has appeared. It's just a kind of imbalance that goes away with the passage of time. Please, I appeal to you, young people, people 14, 15, 16 years old, don't worry about the fact that something terrible is haunting you and some terrible pathology from which there is no escape. These are all coming symptoms. And of course, I have named only 5 main reasons. In fact, there can be many. Moreover, there is pathology of the bronchopulmonary system and many other things. But still, what we have outlined, these are the main problems that people come to a cardiologist with and then move from cardiologist to neurologist or a psychologist or psychotherapist. Be careful. Take care of yourself and be healthy.